Hello and welcome to The Rightest Leftist with Nathan Ogilvie. I'm back from a short little month break and I want to get straight into the next part of the series that I've been building around everyday Aussies and how political issues affect everyday Australians. But I want to sort of today take a little bit of a side detour because my career is as a psychologist and as a mental health professional. I'm really seeing the struggle that everyday Aussies are going through, and in my practice, the people that I work with who are obviously struggling with their mental health, but also that a lot of people in this time of stress and global issues, which we're going to continue to talk about, just this video is not really going to be complaining or attacking or looking at the faults in the political system, which I'm going to continue to do, but looking at how you can get some practical help for your mental health if that's something that you're struggling with. And so it does relate to the last couple of videos about the mental health system, but rather than critique it today, I'm just going to show you what you can do if you're struggling with your mental health. Also in the context of, in the time that I was on that little break, Are You OK Day happened, which in Australia is a mental health awareness day. It's mostly for suicide prevention, around having those conversations and checking in with friends and family, asking, are you okay? But it's actually a really great resource if you haven't ever been on their website, which I'll link in the description, to start having those conversations about mental health and checking in with your loved ones. And what I'm going to share now is my trusty Are You Okay image. And if you have a look here, this image relates to the image I showed you in the previous videos on the mental health care system in Australia. And what you can see here is for where most people are, and it's a good part of the population of Australia, and it may be you if you've never sought out professional or formal mental health support, but most people can get by on self-care, which is a lot of the time the basics: getting a good night's sleep, healthy diet, some kind of exercise, connecting with friends and family, finding a job and maintaining employment. Most people can get by with some kind of self-care, and that a lot of people may be confused with self-help, but if you are reading books about mental health or listening to podcasts and getting that support, that's all informal support as well. You step up and then that goes to informal community care, and that's where you're still not necessarily speaking to a mental health professional like a psychologist or a counsellor or something, but you're getting some more support in the community. So that could be like literal community groups, church groups, sport, school, and even I would put in there things like podcasts and books, especially if it's sort of a human interacting with you. That can be some of that informal community care as well. And then as you step up, we go into the professional support that's out there. And this is what I hope this video can highlight to you if you're feeling a bit lost. Maybe someone checked in on you during Are You OK Day, you've been thinking about your mental health and not sure where to get started, because it is a very complicated system that has a lot of flaws. But where we are today and what you could do from today is a bit of the following. So primary care mental health services are what primary meaning, so that first point of call. So that often means your doctor or your GP, your general practitioner, and talking to them, letting them know you're struggling with mental health support. And there's a test which you can find online called the K10, and that's what most doctors will give you. And literally what it checks is distress. And if you have a high K10 score, if you complete it, it suggests that this person needs counselling. It has sort of a cutoff number, but for some people, even a low level of distress, if you're not used to experiencing it before, can feel really difficult. So it's not so much looking at the score and saying there's something wrong with me, but if you're taking that test and it's coming up with quite a high number, it's probably good to speak to your doctor and look at some more formal support. Then there's things like crisis support lines, which Lifeline, the number is 13 11 14 in Australia, and Beyond Blue, as you can see the image there, are very helpful if you're not able to book an appointment or it is a crisis and you need that support immediately. Those numbers are there. And then as we go up, there's community mental health services, psychiatric services in hospitals, and then long stay facilities. So if your mental health is really bad and you're not able to function in day-to-day life, that's how you move up that pyramid there. And at that point, you'd be checked into a facility and under the supervision of psychiatrists and psychologists. But those community mental health services can also include private practice if you're paying privately, and oftentimes you can get rebates and things through the Medicare system, and that's where the system splits up into that public and private, and it's up to you which one of those you would want to use. There is I was going to show the system in Australia, but as you can see there, how it breaks down, the Australian government funds a lot of this through a range of different networks. So in terms of mental health support for most people, it's through those primary health networks or through Medicare. If you go private and get rebates, which means you pay the psychologist and then you get some money back as an insurance rebate, or the NDIS, which is a National Disability Insurance Scheme for some people who have disabilities or severe mental health issues like autism and they need that support. You can be on the NDIS. So first of all, if you're a young person, there is Headspace, which is an awesome resource if you are under, I think it's 25 or under. And what you can do there is just go onto the website, and there's a whole bunch of resources here. So you can get some online support, things like work and study support. If you wanted to go into a Headspace centre, which they're all over Australia, and you can explore mental health. So you can do a lot of reading in mental health too. Also, if you're a parent and you're struggling with a young person, and that can be an adult as well, like an adult child if you're a parent, there is also support for you as well. There's also similar Head to Health, which is more an adult mental health system, and that's the one that Labor funds. So even though I'm critical of the Labor government, that's that community mental health, public mental health system support, and oftentimes there are longer wait times and the quality can vary, but those community mental health centres are definitely there for support. And you can literally just pop into Google, your postcode or suburb and community mental health, and you'll be able to find your local centre. And most hospitals have some kind of centre as well. They're usually sort of near the hospital. They're not always in the hospital. They're usually like a clinic or something, like tangentially close to the hospital, but they are available. The private system can be a bit complicated, and I've got sort of a dry image here, but what you basically do is you go get a mental health treatment plan from your doctor. So what happens is your doctor will talk to you and do an assessment of your mental health, and then what they'll talk to you about is your goals, what you're hoping to achieve, and then they will a lot of times, if they have a network and they know the specific issue you're having, like anxiety or depression, they might know a psychologist in the area and suggest them to you, or they might just write you a generic referral and you can go find a psychologist. And similar with the community mental health, you can just put your suburb or postcode into Google and write private psychologist or private mental health support, and you'll get a list of businesses and organizations that will be able to help you. You get up to 10 individual per year. I'm not here today to comment on is that too much or not enough, even though I do feel that it's not enough. You do get 10 of those private sessions in a year. What happens though is there's often a gap cost, which means the fee is higher than the rebate, so you'll have to pay an out-of-pocket cost. And depending on the level of the psychologist or the level of their the rebate and what they charge, there'll probably be a gap. A bit of a hack on that though, if you are struggling financially, like if you are on a healthcare or concession card and get Centrelink payments, or you're a student, or you've lost your job, part of your mental health issues related to financial problems, I know a lot of people instantly just think they won't be able to afford therapy, which isn't true. Most clinics, and I know this just from myself, offer reduced or bulk billing. So bulk billing just means that they charge the practitioner or the person treating you charges Medicare directly and you don't even have to pay. So that's why it's called bulk billing, because they do it in bulk, usually at the end of the day or end of the week, for all the people they charged. that they saw but didn't charge directly, or they'll have a lower fee, so you'll still pay something, but it's a smaller amount. And there's actually a bit of psychology to that, because we know from just evidence that if you have a little bit of a buy-in, like if you're not paying for it all, it's perceived as less valuable than paying something. And the classic example is if you saved up to buy a car or an expensive item, versus someone just gifting it to you, you always value it more if you had some stake in purchasing it. And that's why I think, and what I know is, especially from psychologists, most don't bulk bill. It's very rare that they will just fully bulk bill if they're private. But even that small cost, like if you see their fee and in the rebate, which is about $100, and you go, I can't afford that, still try and call or send an email anyway, and explain your situation, that you may be financially struggling, and they might be able to work out a lower fee. Or what they can do sometimes is scatter out the payments. So maybe you go in once a month, but you pay weekly, so the cost, you're not paying the full cost right away, so you're still paying that cost, but maybe over time, so you can still access the service. And then lastly, this is just if you're in crisis mode as well. This is the website for Lifeline. Always, if you're in danger, like if you're in an abusive situation or physically unsafe, but you're still, there's still a mental health crisis too, if there is any danger to your life, you always call 000. But if it's a mental health crisis, like you're feeling suicidal, or you feel like you're going to harm yourself, or even with Lifeline, it doesn't have to be suicidal, you're just having a crisis, you can call 13 11 14. There's also, as you can see, there a text or a chat service if you're not comfortable talking over the phone. There's many alternative ways to get that support as well. So this is just a short video to get back into posting, so I'm going to be posting a lot more for the rest of the year. But I really do appreciate anyone that's watched so far. If you're tuning into this video for the first time, let me know in the comments if this was helpful, and like and subscribe to the channel, like the video, subscribe to the channel, and we will talk again very soon. My name is Nathan, this is The Rightest Leftist, and thank you for watching.